Addiction is a complex condition that not only affects the individual struggling with it but also has far-reaching impacts on society. It encompasses both physical and psychological elements, with the individual becoming dependent on the substance due to changes in brain function and neurotransmitter activity. The impact extends to behavioral and social consequences, affecting relationships, work, and overall well-being. Understanding the components of addiction is crucial in developing effective interventions and support systems for those affected. By addressing the physical and psychological aspects, we can work towards minimizing the detrimental effects of addiction on individuals and society as a whole. The effects of drugs and alcohol on the brain involve intricate interactions with neurotransmitters, disrupting normal communication between neurons. These substances can mimic or block natural neurotransmitters, leading to abnormal signaling that affects mood, behavior, and cognition. In the short term, drugs and alcohol can result in euphoria, relaxation, or impaired judgment. However, prolonged use can lead to profound long-term effects on brain function, including cognitive impairment, memory loss, and changes in decision-making abilities. Understanding these effects on the brain is critical in highlighting the dangers of substance abuse and the importance of early intervention and treatment. Prolonged substance abuse leads to significant changes in the brain's neurological pathways, impacting decision-making, memory, and emotional regulation. The repeated exposure to drugs or alcohol alters the structure and function of the brain, perpetuating the cycle of addiction. Dopamine and other neurotransmitters play a crucial role in this process, reinforcing the reward-seeking behavior associated with substance use. These neurochemical changes contribute to the compulsive drug-seeking behavior characteristic of addiction. Delving into the neuroscience of addiction sheds light on the profound alterations occurring in the brain and underscores the complexity of treating and overcoming substance dependence. Addiction significantly impacts decision-making processes, often leading individuals to prioritize substance use over other responsibilities and consequences. The hijacking of the brain's reward system by addictive substances can lead to impaired judgment, impulsivity, and reduced self-control. These changes in decision-making can perpetuate the cycle of addiction and hinder efforts to break free from substance dependence. Furthermore, behavioral changes associated with substance dependence can manifest as increased secrecy, social withdrawal, and a shift in priorities, often resulting in strained relationships and conflict. Understanding the influence of addiction on decision-making and behavior is crucial in developing targeted interventions and support strategies. Evidence-based approaches for treating addiction encompass a range of interventions, including behavioral therapies, medication-assisted treatment, and support programs. These strategies aim to address the complex nature of addiction, targeting both the physical and psychological aspects. Additionally, it's essential to discuss the potential for recovery and overcoming the effects of substance abuse, emphasizing the resilience of individuals and the effectiveness of comprehensive treatment and support networks. By exploring these treatment options and highlighting the potential for recovery, we can inspire hope and encourage individuals to seek help in their journey toward wellness and a substance-free life. Prevention strategies and early education play a pivotal role in addressing addiction issues, aiming to intervene proactively and equip individuals with the knowledge and skills to make healthy choices. By highlighting the importance of prevention, we can emphasize the potential to avert the onset of substance abuse and addiction, ultimately reducing the societal burden. Moreover, providing resources for individuals and communities seeking to address addiction issues fosters a supportive environment and facilitates access to treatment and recovery services. Empowering communities with information and support can lead to a more resilient and educated society prepared to tackle addiction challenges.